I worked for 12 years as a nurse in the red zone of the municipal emergency hospital. 12 years attending to patients in psychotic episodes, in withdrawal crises, in a state of acute mental confusion. The red zone is where the people arrive who no one else can control. And when a patient is so agitated that they could hurt themselves or others, we need to use mechanical restraint. It's the protocol. We call it tying them down. 4 points of restraint, wrists and ankles secured to the stretcher with padded straps. And then we administer the sedative. Usually midazolam or haloperidol. And the person calms down. Relaxes. Sleeps. But there's something nobody tells you in medical school. There's something I only discovered when I started paying real attention to what they said in those minutes, right after the restraint, right after the medication, before they finally fell asleep. They talked. And what they said, wow, it changed everything I thought I knew about reality. My name is Daniela, I'm 43 years old, and today I'm going to tell you 7 stories that I will never forget. 7 patients who showed me that there is something beyond what we see. And the 7th, if you're feeling this way with me right now, stop everything, subscribe to the channel, turn on notifications, and leave a comment below about where you're listening from and what time it is there, because the next story will change everything forever. There was a man who arrived early Thursday morning. It must have been around 3 in the morning. His name was Rodrigo. He was 34 years old, having an acute psychotic episode. The police brought him in because he had broken everything in his house, was screaming that demons were chasing him, and tried to jump out of the apartment window. When he arrived at the emergency room, he was already handcuffed. But even so, he was struggling so much that it took 4 security guards to restrain him. He screamed non-stop. He screamed that they were coming, that they were going to get him, that there was no way to escape. His eyes were wide open, red, sweat running down his entire face. We had to restrain him immediately. Me, 2 nursing technicians, and a resident doctor. We put him on the stretcher. He was struggling so much that the stretcher was shaking. We restrained his wrists first. He tried to bite my hand. I barely dodged. Then his ankles. He was screaming, "Let me go, for God's sake, let me go, they're going to get me, they're going to take me away." His voice was hoarse from screaming so much. The doctor ordered 10 milligrams of midazolam intramuscularly. I prepared the syringe, approached him, and injected it into his arm muscle. He didn't even feel the needle. He kept screaming. But about 2 minutes later, he began to relax. His breathing slowed. His muscles loosened. And then he opened his eyes. But they opened differently. You know when someone wakes up from a nightmare and is still confused, but no longer afraid? That was it. He looked at the ceiling. And he was quiet. Very quiet. I was beside the stretcher, checking his blood pressure. And then he said, very softly, but I heard perfectly because the room was silent now, "They stopped." I asked, "Who stopped?" He said, "The demons. They stopped chasing me." I stayed quiet. He continued looking at the ceiling. And he said, "There's someone here now." I looked around. There was no one there besides me and the technician who had stayed with me to monitor him. I asked, "Who's here?" He said, It's my grandmother. She died when I was 8 years old. But she's here. She's right there." He tried to raise his arm to point, but the restraint held him. He said, "She's smiling. She's saying everything's okay. That I'll be okay. That the demons weren't real. That it was all in my head. But she's real. She's here." I froze. The coach did too. We looked at each other. And then Rodrigo started to cry. It wasn't a cry of despair. It was a cry of relief. He said, "Grandma, I miss you so much. Why did you leave?" And he was silent, as if he were listening for an answer. And then he said, "I know, Grandma. I know you didn't want to. But I was so alone. He stared at the ceiling for another 5 minutes. Then he closed his eyes and said, "Thank you for coming to get me, Grandma." "Thank you." And he fell asleep. He slept deeply. When he woke up, hours later, he was calm. Lucid. We released the restraint. He spoke with the psychiatrist. He said he remembered almost nothing of the episode. But he remembered his grandmother. He remembered that she had come. And he said something that struck me. He said, "Nurse, I know you must think it was a hallucination. But I know it wasn't. Because I felt it. I felt her there. It was real. More real than anything I saw during the episode. And I believed him. Because I had seen his face when he spoke of his grandmother. And it wasn't the face of someone hallucinating. It was the face of someone who had been visited. But I still had no idea what was to come. 3 weeks later, a woman arrived. She was 52 years old, suffering from severe alcohol withdrawal, delirium tremens. Her name was Vera. She was trembling violently, sweating, screaming that snakes were crawling up the walls, that there were spiders on the ceiling. She tried to rip the 4-line out of her own arm. We had to restrain her. She was thin, but had incredible strength. She scratched my arm when we tried to hold her down. I still have the scar today. Tiny, but I have it. We managed to secure her to the stretcher. She screamed non-stop. The doctor ordered midazolam and haloperidol together. A high dose. I administered it. And about 3 minutes later, she stopped screaming. She became quiet. Still breathing rapidly, but quiet. And then she opened her eyes. And looked at me. And said, "Do you see?" I asked, "See what?" She said, "Them. They're all here." I looked around. There was no one. I said, "Who's here?" She said, "My children. My 3 children. They're right here beside the stretcher." I knew her story. Her 3 children had died in a car accident. 15 years ago. Her husband was driving. They crashed head-on into a truck. Her husband survived. She survived. The 3 children died. And she never recovered. She started drinking. She never stopped. And now she was there, restrained on a stretcher, seeing her children. She said, "They're so grown up. They're not children anymore. They're teenagers. How beautiful. My God, how beautiful." And she started to cry. But she cried smiling. She said, "They're saying it wasn't my fault. That it wasn't. That they don't blame me. That they love me." She tried to raise her arm again, forgetting the restraint, and said, "Son, come here. Let me hug you." And she was silent. As if she were really being hugged. And then she said, "I miss you so much. I ruined everything. I ruined my life." And then she was quiet. And then she said, "They said I didn't mess anything up. That there's still time. That I need to stop drinking. That they want to see me well. That one day we'll be together again. But not now. Now I need to live. I need to try again." She cried a lot. But it was a different kind of crying. It was the crying of someone saying goodbye, but with hope. She said, "I'll try, my children. I promise. I'll try." And she closed her eyes. And she fell asleep. When she woke up the next day, she was different. Calmer. More present. She agreed to treatment. She checked into a rehabilitation clinic. And 6 months later, she sent me a letter. Handwritten. She said she was sober. That she was working again. That she had started talking to her ex-husband again. And that she would never forget the night her children came to her. And that's what saved her life. I cried when I read the letter. And I've kept it ever since. Nothing prepared me for what I was about to experience. The third story involved a 67-year-old man. His name was Nelson. He had been admitted with acute mental confusion, a high fever, and a generalized infection. He was delirious, trying to get off the stretcher, shouting nonsensical things. We had to restrain him because he was pulling on the monitor wires, trying to rip out the catheter. He was strong. Even sick, even with a fever. We restrained him. He shouted that he needed to go home, that his mother was waiting, that he had promised to come get her. His mother had died 30 years earlier. His daughter, Mariana, was in the waiting room, crying. The doctor ordered sedation. I administered it. And about 2 minutes later, Nelson became quiet. He stopped struggling. And then he opened his eyes. And looked at the door. And said, "She's arrived." I asked, "Who's arrived?" He said, "My mother. She's there at the door. Look how beautiful she is. What a pretty dress. White. With small flowers." I looked at the door. There was no one there. But he could see. He said, "Mom, I'm sorry I'm late. I got stuck here. But I'm coming with you now." And he smiled. A huge smile. And he said, "She's saying she's in no hurry. That we have time. That she just came to visit me. To let me know she's okay. That she's waiting for me. But not now." He relaxed completely. His breathing became calm. He said, "Mom, I love you so much. I miss you so much." And he was silent. And then he said, "She said she loves me too. That she's always been close. That she never left me alone." He cried. But it was a soft cry. And then he said, "You can go, Mom. I'll be okay. When the time is right, we'll meet." And he closed his eyes. And he fell asleep. And you know what happened? He got better. The infection responded to the antibiotic. The fever went down. He became lucid. And when we released the restraint, he talked to me. He said, "Nurse, I saw my mother yesterday. I know you must think it was the fever. But it wasn't. She was there. I smelled her perfume. That same perfume she used to wear when I was a child. Lavender. And I felt her hand on my forehead. She always did that when I was sick. She would put her hand on my forehead. And I felt it." He was discharged a week later. And when he left, he hugged me. And said, "Thank you for taking care of me when I was tied up. I know it wasn't easy. But you treated me with respect. And I will never forget." I cried when he left. But I still had no idea what was to come. The fourth story was the most difficult of all. Because it involved a child. She was 9 years old. Her name was Laura. She had been hospitalized because she was having very severe seizures, and during the seizures she became extremely agitated. One day she tried to jump out of bed, hit her head, and needed stitches. Her mother, Fernanda, was desperate. The doctor said it was necessary to restrain her during the seizures to prevent her from hurting herself. And one night, she had a very strong seizure. She convulsed for almost 3 minutes. And then she became very agitated. She screamed, cried, and tried to get out of bed. We had to restrain her. And I swear to you, it was the hardest thing I've ever done. Restraining a child on a stretcher. Even knowing it was to protect her. Even knowing it was protocol. Her mother held her daughter's hand and cried. We administered the sedative. A pediatric dose, of course. And about 2 minutes later, Laura stopped struggling. She became quiet. And she opened her eyes. And she looked at the ceiling. And smiled. A huge smile. And said, "Mom, look." Fernanda asked, "What, my daughter?" Laura said, "Grandma's here." Grandma had died 6 months before. Cancer. And Laura had been devastated. They were very close. Fernanda started crying even more. She asked, "Is Grandma there?" Laura said, "Yes. She's right there. Next to the bed. She's wearing that blue dress I liked. And she's wearing the pearl necklace. Look, Mom." Fernanda looked. She didn't see anything. But she believed. She asked, "What's Grandma doing?" Laura said, "She's smiling. And she's saying I'm going to get better. That the seizures will stop. That I just need to have faith. And she said she loves me very much. And that she'll always take care of me. Even from afar." Laura stared at the side of the bed for another 5 minutes. And then she said, "Goodbye, Grandma. Thank you for coming." And she closed her eyes. And fell asleep. And you know what happened? The seizures stopped. They simply stopped. The doctors couldn't explain it. They did all the tests again. There was no explanation. But the seizures stopped. And Laura was discharged 2 weeks later. And Fernanda came to talk to me before she left. She said, "Nurse, I know my daughter saw my mother that night. I know. And I think it was my mother who cured her. I think she came to get the illness and took it away." And I believed her. Because I had seen Laura's face when she spoke of her grandmother. And it wasn't a hallucination. It was love. It was real. Nothing prepared me for what I was about to experience. The 5th story was the strangest so far. It involved a 41-year-old man named Paolo. He had been hospitalized because he had attempted suicide. He cut his wrists. His girlfriend found him in time. He survived. But he was in a severe psychiatric crisis. Deep depression, active suicidal ideation. He kept saying he wanted to die, that he had no reason to live, that everything was dark. And one night, he started banging his head against the wall. He was banging hard. We heard the noise from his room and ran. When we got in, he already had a cut on his forehead, bleeding. We had to restrain him immediately. He was screaming, let me die, I can't take it anymore." It was heartbreaking. We strapped him to the stretcher. He cried. He cried so much. The doctor ordered strong sedation. I administered it. And about 3 minutes later, he stopped crying. He became very quiet. And then he opened his eyes. And looked at me. And said, "There's someone here." I asked, "Who?" He said, "I don't know. But it's beautiful. It's a light. A very bright light. It's coming from the corner of the room. And there's someone inside the light. I can't see their face. But I feel it's someone good. Someone who loves me." I looked at the corner of the room. I didn't see anything. But he did. He said, "This person is saying that I shouldn't give up. That my life has a purpose. That I still have a lot to do. That there are people who need me. That I am important." And he started crying again. But it was a different kind of crying. It was the crying of someone receiving comfort. He said, "I don't believe in God. I never have. But I'm feeling that there's someone here. And this someone doesn't want me to die. This someone is saying that I am loved. That I have always been loved. That I just couldn't see it." He kept looking at the corner of the room for another 10 minutes. And then he said, "Thank you. Thank you for coming. I'll try. I promise I'll try." And he closed his eyes. And he fell asleep. And when he woke up the next day, he was different. He agreed to talk to the psychiatrist. He agreed to take the medication. He agreed to go to therapy. And 3 months later, he sent me a message through the hospital's Instagram. He said he was doing well. That he was working again. That he had regained hope. And that he would never forget the light he saw that night. And that it was what saved his life. He said, I don't know if it was God, if it was an angel, if it was someone who had already died and came to help me. But it was real. And it changed everything. And I believed him. Because I had seen his face when he spoke of the light. And it wasn't a delusion. It was an encounter. But I still had no idea what was to come. The sixth story was witnessed by more people. It was the one that left me most shaken. Because I wasn't the only one who saw it. There was a 55-year-old man named Carlos. He had been hospitalized because he was having severe hallucinations, intense paranoia. He thought everyone wanted to kill him. He kept saying there were conspiracies, that people were following him, that they were going to poison him. And one night, he had a very violent outburst. He broke the window of his room, grabbed a shard of glass and threatened to cut himself. We had to call security. There were 3 security guards, myself, 2 nurses and a doctor. We had to restrain him. He was screaming, struggling, trying to bite. We managed to restrain him. But it was a struggle. The doctor ordered strong sedation. A high dose. I administered it. And about 3 minutes later, he was quiet. He stopped screaming. And then he opened his eyes. And looked at the ceiling. And said, look at this. Everyone in the room looked. There were 6 people in the room at that moment. And then he said, a light is coming down from the ceiling. Can you see it? Nobody saw anything. But he could see it. He said, the light is coming this way. It's coming towards me. And there are people inside the light. There are many people. I can't see their faces. But they're all dressed in white. And they're smiling. And they're saying that I don't need to be afraid. That nobody wants to hurt me. That all of this was just in my head. That the illness was making me see things that didn't exist. But they exist. They're here now. And they're real. And then something happened that I'll never forget. One of the nurses who was in the room, Marcelo, said, guys, can you feel it? And everyone stopped. And felt it. The room got warmer. It wasn't stuffy heat. It was a good warmth. A warmth that came from within. And there was a feeling of peace. Everyone felt it. Everyone. The doctor who was there, Dr. Juliana, said later that she felt as if someone had hugged her. The security guard said he felt a pressure on his chest, but a good pressure, like a hug. And I felt the room was full. Full of presence. Full of people. But invisible people. People who were there to help. Carlos stared at the ceiling for another 5 minutes. And then he said, they're leaving. But they said they'll come back. When I need them. They'll always come back. And he closed his eyes. And fell asleep. And when we left the room, everyone was silent. Nobody could speak. We went to the break room and sat down. And then Dr. Juliana said, guys, what was that? And nobody knew how to answer. But everyone had felt it. And Carlos? He got better. The medication worked. The paranoia decreased. He became more stable. And when he was discharged, he came to talk to me. He said, nurse, I know I was tied up that night. I know you had to hold me down. But I don't hold a grudge. Because it was that night that I received help. Real help. Not just from you. But from the person who was there with me. Invisible. But present. And I cried. Because I knew exactly what he was talking about. Nothing prepared me for what I was about to experience. And then came the 7th story. The one that changed everything. The one that happened to me. It was a Saturday night. I was in the middle of my shift. It had been a tough night. 3 restraints in a row. I was exhausted. Physically and emotionally exhausted. And I went to the bathroom. I washed my face. I looked in the mirror. And I saw that I was different. Older. More tired. With deep dark circles under my eyes. And I thought, I can't take this anymore. I was seriously thinking about quitting. About leaving the red zone. Because it was too much. To see so much suffering. To see so much pain. And to have to restrain people. Even knowing it was to protect them. It was too much. I left the bathroom and went to the break room. I got a coffee. I sat in a plastic chair. And I stayed there, alone, in the silence of the early morning. It must have been around 3 in the morning. And then I felt it. I felt a presence. I turned my head. There was no one there. But I felt it. I felt that someone was there with me. And then I heard it. It wasn't a loud voice. It wasn't an external voice. It was a voice inside my head. But it wasn't my voice. It was another voice. Calm. Soft. And the voice said, "You are doing the most important work in the world." I froze. I looked around. There was no one there. But the voice continued. "You are holding people when they can't hold themselves up. You are taking care of them when they can't take care of themselves. You are being God's hands on earth." I started to cry. I cried so much. Because I needed to hear that. I needed to know that what I was doing had meaning. And the voice continued. "Don't give up. Never give up. Because there are many people who still need you. There are many people who will still be saved by you. You are important. You are loved. And you are never alone." And then I felt it. I felt a hand on my shoulder. A warm hand. Firm. But when I looked, there was no one there. But I felt it. I felt the hand there. Holding my shoulder. Giving me strength. And then the presence was gone. But there was a feeling that I had been visited. By whom? I don't know. It could have been an angel. It could have been God. It could have been someone who had already died and came to help me. I don't know. But it was real. And it changed everything. Because that night I decided I wasn't going to give up. That I was going to continue. That I was going to continue holding people when they couldn't hold themselves. That I was going to continue caring. That I was going to continue being the hands of whoever was using me to do good. And I continued. I continued for 3 more years. Until I retired. And today I look back and I know. I know it was worth it. Every difficult night. Every struggle. Every tear. It was worth it. Because I helped. I helped many people. And I was helped too. By something greater. By something I still don't fully understand. But that I know exists. I worked in that ward for 12 years. I performed hundreds of restraints. I administered sedatives to hundreds of patients. And I can tell you with absolute certainty, there's something beyond. There's a higher power watching over us. There are people on the other side waiting. There's light. There's love. There's peace. There's help when we need it most. I saw it. I heard it. I felt it. And now I know. There are studies about it. Dr. Bruce Grayson, in the United States, studied thousands of near-death experiences and deathbed visions. Dr. Raymond Moody dedicated his entire life to understanding what happens when we are near death. Dr. Pim van Lommel, in the Netherlands, studied patients who suffered cardiac arrest and saw things that science cannot explain. There's a phenomenon called shared death, which is when several people feel the presence of someone who is dying or who has already died. Science still doesn't explain everything. But science is beginning to accept that something is happening. Something that goes beyond what we see. But I don't need studies to know that. Because I saw it with my own eyes. I heard it with my own ears. I felt it in my own skin. And now I'm not afraid of anything anymore. I'm not. Because I know that when my time comes, there will be someone waiting for me. There will be someone to hold me. Someone to take me home. To my true home. And it will be beautiful. It will be warm. It will be light. It will be love. And if you're listening to me now, I want you to know, you don't need to be afraid. You don't need to be afraid of anything. Not of death. Not of suffering. Not of loneliness. Because you are not alone. You never were. There has always been someone taking care of you. There always was. You just couldn't see them. But they are there. On the other side. Waiting. Caring. Loving. So live. Live with courage. Live with love. Take care of those around you. Hold the hand of those who need it. Because one day you will cross over. And when you cross over, you will understand that everything made sense. Everything. Every pain. Every tear. Every difficult night. Everything made sense. Because everything was preparing you for this moment. The time has come to go home. And you'll see that home was never here. Home was always there. On the other side. In the light. In love. In peace. Thank you for listening to me this far. Thank you for feeling with me. And if you know someone who is afraid, who is suffering, who is thinking of giving up, share this story. Because there are many people who need to hear it. There are many people who need to know that they are not alone. That someone is caring. That someone is waiting. And that everything will be alright. In the end, everything is always alright. Always.